A very common referral to you is headache. How do you know a headache is something not so serious from a headache that could be something serious?
Well, headaches are very common in children, and most patients that have headaches that are children tend to have migraines. The way we know if someone has a migraine is by the story. Migraines tend to run in families. They tend to cause headaches that last from half an hour to days. And the headaches are commonly associated with nausea, dizziness, sometimes vomiting, and the child will actually, during a headache, not like lights and noises. Very typically will turn off the lights or will say, please be quiet to his mother or her mother. And finally, headaches that are migraines that are not concerning in terms of any bad stuff going on tend to be made better by lying down. So if one meets all those criteria, that is reassuring, and we don't generally do tests on those patients if they are normal when we examine them.
When do you think a headache is an indicator of something very serious?
Well, I think serious headaches are very rare in children, but if a headache gets worse when one lies down, if it's waking patients up from sleep, although migraines can wake you up from sleep, so that shouldn't be something that makes everyone anxious in and of itself. And certainly if they have an abnormal neurological examination, that can be something more serious and would require
that means
brain imaging.
Does that mean that if a kid can't move one arm, that's a problem, isn't it?
Well, if a child has a headache and can't move an arm, that still can be a migraine, but certainly should be looked at urgently.
What about if a kid wakes up in the morning every day, has headache and vomiting? Is that a hallmark of anything?
Well, you can wake up with a migraine in the morning, but if it's a new onset problem and they're waking up every morning and waking up from sleep vomiting, that would be of some concern.
What about if the kid sees double?
Again, that could be a neurological problem. Any new neurological finding would be of concern in the context of having a headache in addition.